do you have any kind of things that you would recommend are must address or things that they can do to prepare to navigate this postpartum if they know they're a type A mom?
Yes, I would say, like, first and foremost, please just give yourself so much grace and compassion. Like, you have to soften that inner critic, right? You have to be aware that, one, there is that inner critic, that you are your biggest critic, and you have to soften that voice, like turn the volume down significantly on that.
From the moment that life-changing stick revealed its verdict, our journey began. Suddenly, we were entrusted with the monumental task of motherhood. But amidst the joy, fear of the unknown sets in. How do we navigate this uncharted territory? With countless voices ready to guide us, it's easy to feel lost. Hey, I'm Hillary. I'm the founder of Baby Settler. I'm also a registered nurse and mom of 4. I hope to be your trusted friend who helps guide you through the maze of early motherhood. I'm grounded in medical expertise with a sprinkle of crunchiness, and I'm here to debunk myths and unravel truths. With a dash of type A energy, I promise to leave no stone unturned. Joining me on this adventure is my non-medical older sister, a future mom herself. Together, we'll get into the heart of early motherhood, asking the tough questions and seeking honest answers. So grab a cup of coffee, steal a moment for yourself, and let's dive into the adventure of early momming together.
All right. Welcome back, mamas. We have an excellent conversation to share with you today.
I'm Hillary, the founder and CEO of Baby Settler, and I'm also a mom of 4.
And I'm Erica, Hillary's big sister, a future mom, and our listeners' non-medical type A ambassador each week. I'm excited about this conversation and this guest that we have today, Hillary, Dr. Alice Pickering. But before we get to that, we actually have not spoken. We've gone I think the last week where we usually speak probably every other day at least.
I know. What happened? You ghosted me.
I did not ghost you. I don't know what happened. I actually realized on Saturday night that you called me and I totally missed the call and just never called you back. So
and you were texting, you and Nate were texting my husband, but ignoring my phone calls. Luke actually said to me, have you talked to Erica lately? And I was like, no, I haven't. I've actually called her and she's ghosting me.
Okay, so, but I'm pretty sure we did talk on Friday, to be clear.
Did we?
I'm pretty sure. Yeah. We talked on Friday, I'm pretty sure. And then Saturday I did ghost you. And today is now Wednesday? And we haven't spoken.
And we have spoken via reels that we've been DMing each other on Instagram without actually saying anything. We just DM reels. So technically that is talking, right?
Yeah, it's communicating in some sense, I guess. But that's how I mean, some of my best friends, that's how we stay connected, honestly.
No.
It's just messaging reels back and forth.
Yeah.
Honestly, me and Nate, sometimes that's how we communicate.
I know. It's so funny. Me and Luke do that too, which I don't know. What does that say about us? I don't know. I don't think it's unique to us. It's our generation.
Yeah. I don't know. There's so many funny things. Then you realize you're not alone and everybody's weird like you are with your husband.
Yeah, totally.
Well, what's going on? Tell me what I've missed in the last several days with the fam.
I had a back injury this weekend. I have never, not really a major injury, but I've never had back issues in my whole life, but Luke has for many, many years. And I'm always I have sympathy for him, but I've never had empathy. I don't really know what it's like. And Saturday morning, or no, I think it was Sunday, I woke up and my back just felt tight, kind of like I had a pulled muscle, not really a pulled muscle, but the thought in my brain was my back kind of hurts, but not really, but sort of. And then I went to get Clay out of his crib and all of a sudden I completely had to put him down and could barely stand up to walk out of his room. It was intense.
Oh, no.
So I have been dealing with back pain all week and I hate taking medicine. I finally did take some Motrin because I know that it's inflammation. And I scheduled myself an appointment with a pelvic floor physical therapist next week who actually works out of my same office, because I know that it's because my core is weak, because I have had 4 babies and I haven't done good core strengthening and my posture is terrible. So I saw Marianne. She actually works with Rome Physical Therapy. They are amazing physical therapists, pelvic floor physical therapists in the Charleston, South Carolina area. So if you are looking for a pelvic floor physical therapist, by pelvic floor for back, also back and core, like it's very much connected. I was like, Marianne, what do I do? And so she showed me a few exercises. We both have been seeing patients in the office all week. And so she gave me a few things to work on, but I have my official follow-up with her next week.
Yeah. I usually go to the chiropractor when I'm having back issues. You're going to see somebody about your pelvic floor. So I feel like that's
well,
a big difference
here's the
between me and
deal. Root cause. Like, right? Chiropractor,
Yeah.
I mean, sure, they can, if it's out of alignment, they can pop it and put it back in, but it's usually musculoskeletal. So it's going to be like, okay, well, why is it out of alignment anyway? Your muscles and your pelvic floor and your core is what's going to help keep that pop in place, right? Because if you just pop it back in place, but you don't do the deep work, then it's going to pop out again. So yeah, different. Yeah.
All right.
Yeah. What about you? What have you had going on?
Not a lot here, just a lot of work and still working on this house. I think we're at the point where we're doing our final walkthrough next week. So
That's exciting.
Really excited about that. I wanted to tell all of our friends, mama friends here, that I have officially signed up for real world parenting experience. I am keeping Hillary's 4 children when Hillary goes to Europe. She's going to Europe with Luke for 9 days. And
actually, I think it's 10.
Okay. Well,
Sorry.
We're going to go with half glass full on this one. By my math, it's 9 days. Maybe it's 10, probably more like 10, but going to Europe. I'm so excited for you. Y'all have not been on a big trip like this in a really, really long time. So excited for that, but a little nervous for me because I'm going to have care of your 4 kids. So that is going to be interesting. What do you think? How do you think that's going to go?
I'm excited about that. I didn't bring that up because I am like, it's funny, 2 months ago, I was like, I had my spreadsheet out every night. I'm like trying to plan our itinerary, figuring out where we're going. And then in the last 2 weeks, I don't know. I am so excited. It is Luke and I celebrated our 15-year wedding anniversary this past January. So, and we didn't even go out to dinner. Not because we didn't want to, but just because life with 4 kids is hectic. We definitely try. I mean, we do try to go out to dinner, and we just went out to dinner a couple weekends ago, but it's hard to just coordinate those kind of things. So Luke and I were like, you know what? We just need to get away and just have it be us. And I haven't been to Europe since I was in 8th grade, and Luke has never been to Europe. So I'm excited, but our trip was initially, Erica, if you remember, it was supposed to be 13 days. And then we shaved 3 days off of it because Luke and I were like,
when you called and said, I hope you're not upset, I was like, oh my God, thank God. Thank God she's coming back. I wasn't going to make you feel bad. Like 13
well, you
days
didn't.
I was going to do it.
You didn't. So
I'm trying to build up my karma with baby settler, because when I have a baby, my expectations are that you drop whatever you're doing when I go into labor and you get your butt out to Arizona, and I expect you to be here for a significant amount of time.
Yes. We keep telling Luke, hey,
it's the Luke karma is what I'm really after. Yeah.
Yeah. Like, Luke, I came and watched your kids for 10 days while you were in Europe. I get to have Hillary for at least 10 days in Arizona after I have my baby.
It's an equal trade, 100%.
Equal trade. Yeah,
equal trade.
For sure. But actually, Luke's mom was the one that said to me multiple times, she asked me the same question multiple times. How long are you guys going to be gone? And I would tell her, are you okay with being away from the kids for that long? And I was like, yeah, sure. Like, yeah, it'll be fine. And then I think it was last weekend or the weekend before, Luke and I were talking, and Luke wasn't like, I think we should come home sooner, but he was like, that's going to be a long time, or, you know, do you think you're going to be okay? And I was like, you know what? I need to really sit with this and think about this for a little while. Because Clay's only 2, you know, our older kids, they would probably be totally fine, but Clay is only 2. And after thinking about it, I was like, you know what? I think we might be there for 14 days, but I'm sure after 8 days, 8 or 9 days, I'm going to be ready to come home and we can go back again. Right? Yeah. We can bring you back again and you can watch something. Just kidding. So we're just going, Yeah, we're just going for 10 days, but I'm excited. I think it's going to be super fun. Super fun.
For you or for me?
For both. You're going to love it.
Okay.
You're going to have our nanny during the day. So, but you are going to be working from home. So you'll be working from actually this podcast office. You'll be working from, but I'm going to do a lot of prep work. I've got a binder that I'm going to put a lot of information in. So you're going to have a manual, and also I'm going to meal prep for you. And our nanny is amazing. And our 12-year-old cooks dinner one night a week. So that's one less meal a week.
And let's be clear, my mommy is also less than 2 miles down the road. So if I get into trouble, I can always call home.
Yeah.
You know?
Yeah, for sure. For sure.
Yeah, good. What do you think is going to be my biggest challenge in those 10 days?
I don't know.
Have you thought about what kind of trouble I'm going to get into?
No, I think for you, the most overwhelming part is going to be dinner, bath, and bed, and just the hours from 3:30 p.m. until 7 p.m. I think that will be the most challenging time of the day, but maybe not. I'm definitely going to be excited to hear, hopefully not excited to hear if something was super challenging, but just excited to hear your perception.
Yeah. Well, I expect the karma and the reciprocity in, trading. But I also expect French butter. I've sent you several of the Instagram reels that I have sent you over the last 7 days have been of sourcing this butter that I expect you to bring back for me from Paris.
We will definitely bring you butter.
Okay. That's great.
For sure.
That's great. Well, I have a little bit of a game that I wanted to play with you. I think that this will lead to maybe some good tips or maybe some conversation. But first, did you ever, I don't know that you were ever exposed to this website because you are such an innocent, protected, lovely, protected mind.
Is that your way of saying gullible?
No, just, protected. Like Luke and I have joked about this before. Like there's jokes that you don't get because you're just so innocent and like not exposed to worldly things sometimes. But there was this website called Hot or Not when we were like in high school or college. Do you remember this?
I have never been to that website.
Okay. Well, it was like, think back to the year 2000. It was like, we were in high school. Okay. You were maybe like pre-high school at that point. But it was like a couple years at this website called Hot or Not. And basically you went on this website and it was like the early versions of Tinder, which you also don't know about, and Bumble, which are the dating apps of today that you don't remember. But anyway,
because I married my high school sweetheart.
Yes. So you've never had to deal with this, but I am sure moms on this podcast that are listening know what I'm talking about. I am certain of it. So in the year 2000, there were 2 Stanford college students that created this website called Hot or Not. And basically you got on and you could put your picture on there and you could put your picture on there as a profile, and people could just go through and it would serve you random pictures and people could vote hot or not. So gosh. I know. It was crazy. It was a crazy time. Now
did you put your picture on there?
I think so. I mean, I want to believe that I did. And I was always hot. No, probably not. But anyways, there was this website. So this has inspired subsequent social media, like dating apps or whatever. But I want to bring Hot or Not to Baby Settler. or not to baby settler, to early momming. So I'm going to list some things that new moms might have on their list for
this is going to be fun.
Baby. And you're going to say hot or not, meaning hot, yes, gotta have, or not, don't waste your money on it. Move along.
Okay, got it.
Okay,
yes,
so
I'm ready.
I got a list. Okay. Are you ready? And you can say hot or not, and then if you need to explain, just say, let me explain.
Okay.
Okay. So I did source a list of most recommended items for newborns. Okay.
Okay.
First on the list, hats and mittens for a newborn.
Not.
Why?
You don't need a hat after the first 24 hours. Like the reason we put hats on babies at birth is because they're trying to regulate their body. Like in the first 24 hours, that's part of adapting to extra uterine life. So if they have hair and their hair is wet, then they're going to lose heat through their head. But really after the first 24 hours, they don't need hats. Now, if you're outside and it's 30 degrees outside, then yes, put a hat on your baby. But generally speaking, most people don't have their newborns outside in 30-degree weather. If you live up north and it is that cold and you're the winter, then hat during transport in and out of space. But generally, you don't need a hat or mittens.
Good. Awesome.
And it can actually be a safety hazard. You definitely don't want your baby sleeping in a hat because you don't want the hat to come down over their nose. So definitely do not sleep in a hat.
Okay, good. All right. Hot or not, socks and booties.
Socks, yes. Hot. Socks are hot. Booties, I would say hot. If it's cold out, they're hot. If it's hot out, they're not.
If they're cute, they're hot.
If they're cute, they're hot. Yeah.
They're hot. Okay.
Yeah.
How about like I don't know if these are expensive or not, but it said like name brand diaper genie. Hot or not?
Diaper genie, hot. For sure.
Hot.
So that is the diaper pail I've had for the last 12 years. Diaper genie.
Okay.
Hot.
Great. Hot. All
that
right.
specific brand.
Okay. That specific brand is hot. Nursing pillow, hot or not?
Hot. My breast friend. A lot of them are not hot, but the my breast friend is hot.
Wait, why are the other ones not hot?
They're not ergonomically correct. The what is it called? The baby. Gosh, I'm like drawing a blank right now. My breast friend is the best breastfeeding pillow on the market, in my opinion. And every single mom that comes to my office and uses it ends up buying it because it's such a good, it just positions the baby correctly at the breast. But that is a brand. It's my breast friend.
Great. All right. Hot or not, newborn bibs or bibs for newborns?
Not.
Okay. Because you're using
burp cloths,
yeah.
Yeah.
Okay. A bottle sanitizer machine. Hot or not?
It depends on if you are, I would say not, because most people have sanitized on their dishwashers. If you don't have a dishwasher and you don't have a microwave, because you can also buy bags to sanitize them in the microwave, it's just another gadget that you need on your counter.
Yeah. Okay. So if you have another way to sanitize it, not. But if you don't, hot.
Yes.
Okay. I got served this video of this lady cleaning one of those bottle sanitizing machines. And she, I guess, didn't ever look underneath it. And it was gross.
I bet.
I got
with
that,
condensation and mildew and stuff. Yeah.
Yeah. It was all moldy and stuff. Okay. Hot or not, bassinet for the bedroom.
Hot.
How long? How long is that hot?
Depends on your comfort level with moving them to their own crib in their bedroom. I usually say when babies are sleeping 6+ hours uninterrupted at night, that's a good time to transition them to their room for nighttime sleep. So could be as early as 6 weeks, might be as late as 3 months. My recommendation is to have them in their own room by 3 to 4 months. All
right. Okay, hot or not, baby-specific newborn laundry detergent.
Not
necessary.
Marketing. Yeah.
Okay.
It's, right. I mean, I am definitely for hypoallergenic, low toxic detergent for sure, but it can be the same detergent that the rest of the family uses.
Okay. Hot or not, toys for a newborn.
What age?
Newborn. This was
So
literally
newborn
a
is
list of newborn things that you need for a newborn at home.
So a newborn is 0 to 28 days old. So the first month of life. Okay. So 0.
Do they need toys?
No.
In the first 28 days? Okay.
No.
So when would a newborn?
Like 6 weeks. I mean, between 4 to 6 weeks. I mean, and really maybe a little bit sooner than that. But the first 2 weeks, they're just eating and then they're going back to sleep. They're not even, there's not even time for anything else. But some black and white cards, if that counts as a toy, a mobile, like a play mat. They're basically just looking at stuff for the first 6 weeks. And then after that, you can bring in some actual toys. But in the first 6 weeks, they're not going to be able to play with anything.
Okay. Hot or not, a baby swing?
In my opinion, not. I'm sure there are moms that would disagree with me. I have not had a baby swing since my first child. I did not have one with my second, third, or fourth child. And I feel like they're a waste of floor space. And then they're also, if you use them a lot, I worry about torticollis. They are not good for promoting independent sleep. I would much rather use like a baby Bjorn bouncer or do like a bouncer seat.
Okay. So that was the next hot or not, baby bouncer.
Absolutely hot.
Okay. All right. Yep. That's great.
Yeah. Is that it?
That's it. That's my list.
Yeah, good. That was fun.
Okay. Yeah, good. All right. I'll keep thinking of, maybe we'll come back to hot or not later. So you'll have to, I wonder if the website's still up. We'll have to look and I'll show you the hot or not website. It's just called Tinder now, I'm pretty sure, which you don't know what that is either. So
I have heard of Tinder before. Okay. That's when you like swipe if you think somebody's hot or not.
Yeah. And then you match.
Yeah.
That's how people are dating now.
Okay. Got it.
Okay. So we'll jump into our topic for the day. We had a conversation with Dr. Alice Pickering, which is really awesome. We actually recorded that a couple weeks ago because our availability was a little different, but we talked to her about navigating postpartum as a type A mom, talking about the mental load and a little bit about the default parent. So, before I introduce her, can you talk about why is this topic important to you? Why did you want to talk about this on the Early Momming podcast?
Well, in case you're new here, I am definitely type A. So I have a lot of experience with postpartum type A mom, as being one myself, but also working with a lot of type A moms. I feel like Baby Settler, our private practice in Charleston, the majority of the moms that we work with are type A. And that's probably because they are having feeding challenges and they're type A. And so they want a plan to fix them and to figure things out. And then also sleep is important to them. Getting on a routine, having a predictable routine is important. What I will say is that I feel like type A moms are at higher risk for anxiety and depression in the postpartum period because we have a lot of expectations for ourselves and there are a lot of things that are out of our control. And that is not, we don't like for things to be out of our control. So that's really why I wanted to talk about this and just give moms who may identify as type A some tangible tips for really navigating the postpartum period.
Mm-hmm. And I think that maybe validation of how they're feeling. I think that's what I came away from the conversation is that Dr. Alice, which we're on a first name basis now, so we can call her Dr. Alice. But I think that I learned that the patients that she works with, after talking to her, they feel very validated and maybe even, you feel validated after talking to her that it's not just you. So
absolutely.
Good. Well, I'm going to introduce her and I'm going to do my best. I'm not going to read, but I do have notes here because she is so credentialed and she has so many degrees. But she is a licensed clinical psychologist and a certified clinical trauma specialist. So she has a passion for serving women and mothers through various life stages. And she specializes in mood and anxiety disorders in the perinatal space. So some of her degrees that she holds, she's got a Bachelor of Science in Psychology, from the University of Arizona. She has a Master of Arts in Clinical Psychology. She's got a doctorate of psychology. She completed an internship program at Arizona State Hospital. She is licensed, PsyPact licensed in the state of Arizona, and she has a lot of clinical training and education experience. So if you want to look at her full credentials, she's going to mention in the episode where you can find her on her website. So please, if you have interest in that, please take a look at that. She owns a private practice here in Arizona. Coincidentally, we should have gotten together and recorded together, but I actually didn't know until we got on the on the conversation with her that she was here. But she owns the private practice here, and she treats issues related to depression, anxiety, trauma, life transitions, and relationships. And she does that all remotely. So if this episode speaks to you and you feel like she would be helpful to you, she does work remotely. But before we get into this episode, which we're really excited to share with you, we actually have our first sponsored episode, which is Baby Settler.
This podcast is brought to you by Baby Settler. Here's the deal. Most parents and healthcare professionals don't realize that 95% of the sleep puzzle in the first 6 to 12 months is feeding. Your baby needs to be able to take a quality, efficient, effective feed, whether they're breastfeeding or bottle feeding, to be able to drop nighttime feeds. There is a very uncomplicated strategy to this. In my ultimate guide to nighttime weaning, I walk you through it step by step. It's a guide for babies 0 to 12 months old, delivered through our custom Baby Settler app. Go to babysettler.com to find out more. You deserve to be the best parent you can be, and I truly believe that as parents, we need uninterrupted sleep to thrive.
All right, thanks to Baby Settler. Without further ado, please enjoy this conversation with Dr. Alice Pickering. All right. Well, Dr. Alice Pickering is with us today. Welcome to the Early Momming Podcast.
Thank you. I'm so happy to be here.
We are so excited to meet you. I think you and Hillary have known each other for just a little bit, right? Hillary, how did y'all meet?
Yeah, we've never met in real life. We talked about meeting in real life when I was out in Arizona a couple weeks ago, but I feel like we met a couple years ago on Instagram. Our views about things are very similar. Alice, how old is your youngest? Because I feel like when we first met, or we first started kind of sharing each other's content and having conversations on Instagram, I had 3 and you maybe had 2 kids. And now we both have added an addition.
Yes. Yeah. My youngest, he is 6 months old. He just turned 6 months. And my oldest is 5.5. So and then my 4-year-old is sandwiched in there too. But I have 2 girls and they're a year and a half apart. And that was a lot.
Yes.
That was a tough period, them being so close in age. But yeah, the youngest 6 months just recently.
I think it's interesting to go through early motherhood, being that we're both kind of healthcare professionals in this space, and working with people in private practice, but also seeing the landscape of social media, then also being a mom that's in it and going through it definitely is. It's easy to fall into different polarizing topics on Instagram, which we can get into that later, but
we definitely will get into that. All right, Dr. Alice. So why don't you tell us just a little bit about who you are and, what you do in this space?
Yeah. So, first and foremost, I'm a mom. I've got 3 beautiful kids, and I am a licensed clinical psychologist, and I didn't always start out in the field of maternal mental health. I actually was forensic before I even had kids. A lot of what I was doing was forensic work. Yeah, it's like a night and day difference between where I was and what I'm doing now. But kind of just through my own personal experience of trying to grow my family and starting my family in that process. And then even after becoming a mom and being a new mom, there was just such I just realized what a gap in services there are for mothers. When you're trying to conceive, when you're pregnant, when you're postpartum, even thereafter, there is just such a huge gap. And, I had been in the mental health field and was in the mental health field for several years before becoming a mom. And I like never heard of like mood and anxiety disorders for mom. It just was like not a thing. And so when I became a mom, I was just like, what is happening to me? What is going on?
Mm-hmm.
I don't know what I'm doing. Yeah. I don't know why I'm feeling all of these really big feelings. I don't know why I'm struggling so much. There's just a lot. And so kind of through that experience, I just decided like, okay, I need to, like, I just had a big passion for just shifting that focus. And, I got training, certification in perinatal mental health. I also added trauma to there. And so it was kind of just naturally
there
through that
is a
process.
lot of trauma.
Yes.
Yeah. I don't mean to cut you off, but I want you to
You're
finish
good.
telling
Yeah.
us about you. But I was just actually seeing a patient today, and she was telling me, we spent the first 20 minutes of our consult, and she was just like debriefing about her delivery. And you could tell, I can't remember from nursing school what those stages are called, but aren't there different stages that you go through?
Grief. Yeah. Acceptance, bargaining, depression, anger, denial. I didn't list them in order. Acceptance should be at the end, but yes, the 5 stages of grief.
Yeah. And just like not having the birth that she kind of wanted. Yeah. And, I think that trauma is a trigger word in that people think it has to be like this really bad thing, but I feel like trauma, and you can obviously speak to this, but something could be traumatic to me and it's not traumatic to you. Right. And so I think that's, yeah. But anyway, I didn't mean to cut you off. So anything else to add about your
not
expertise, your
particularly,
background?
other than I just had like this total, 180 flip between forensics to perinatal mental health. And then that's what I've been specializing in for the last 6 years, and so that's been kind of my niche. That's where I've sought out a lot of additional training, a lot of, education alongside that, CEs, all that good stuff. And then it's what the population that I primarily serve in my private practice.
Yeah. So can you tell us a little bit about, before we kind of jump into the topic, a little bit about your private practice? It's fully remote, right? You're based in Arizona, but your practice is fully remote.
Yes, that's correct. Yeah. And I'm also licensed to practice in multiple states as well. And so I kind of serve a lot of different people in the U.S., so a lot of different states in the U.S.
All right. Well, we're going to kind of jump right into the topic. So the topic is, navigating postpartum as a type A mom. We want to talk about the mental load, and the default parent is something that we'll get into a little bit later. So can you start off by maybe defining some of the type A traits that you see and how they may shape the postpartum experience?
Yeah, totally. So I guess I would say I'm kind of a type A mom myself. So
I was going to ask, do you identify?
Me too.
Do you identify as type A?
Yeah, I would say like naturally my inclination is to be type A, but I've done a lot of work to become a little more type B. So type A
is that because you feel like type A is a negative thing?
So in some aspects,
not trying to put you on the spot.
Oh, no, you're good. No, there are some parts of being kind of this type A personality that are for sure strengths. Like I can identify those strengths. I'm all for it. I also see where I have a lot of limitations as a result of that as well. And so then I try to kind of adopt more of that flexibility. So in kind of differentiating between a type A and type B personality, type A individuals are very like goal-oriented, very organized, very methodical, process-oriented, high achieving, all the things, kind of perfectionistic at times too, we can throw that in there. And I would say it kind of exists even on a spectrum, right? Like there are certain personality traits that we all have. Some of us display them more strongly, some a little less. But then type B personality traits are more, somebody who's a little more go with the flow, a little laid back, maybe not as organized, they're just kind of more relaxed all around. But interestingly enough, the kind of type A and type B personality traits were it came from like research of cardiologists who were looking at heart disease, and they found that people who have this like type A personality traits are sadly more prone to heart disease, like down the road and in the
Oh my
future.
gosh.
And it's because of like this high stress, and like,
Yes.
and this inability to kind of relax. And so that's where, it's kind of just historically the research behind that a little bit, but that's where we've derived at this concept of like type A, type B personality.
So I feel like type A and type B often go together. Do you think? I don't know. Do you see that?
Like you're talking about from like a couple standpoint.
Partners.
Yeah.
Yes. I'm just sitting here thinking about, okay, you described me and then you described my husband. And it's so funny when you say like, can't relax. I can't tell you how many times, we're sitting down, it's the end of the day, we've kind of done all of our tasks, and I'll be sitting there and Luke is looking at me, and you can just tell that he's like looking, trying to figure out, or he's like making fun of me in his mind about how he knows that I'm thinking about something. Mm-hmm. And I'll say like, what? And he's like, nothing. I'm just watching you think about, watching you stew, or, he can tell. And then I'll say to him, how do you just not think about anything? Like he has this, it's a gift for you. I feel like it is a gift to be able to just not think about anything. The only time I'm not thinking about anything is when I am asleep. And maybe that's why I like sleep so much, because it's a shut off, but gosh, like, so I get what you're saying. And I think that, and I do have a mental health therapist that I have worked with locally here in Charleston. And I can hear her in my mind saying like, you need to practice that. Like you need to practice like purposely not thinking about anything. And she's so right. And it sounds like you would agree with that, but it's hard. And especially in motherhood and early motherhood, my oldest is 12. And so I haven't experienced, the real teenage years yet, but I imagine there's also a lot of anxiety that pops up in those years. But with early motherhood, whether it's an infant or, man, I could go over a list of things that make me anxious, and then all the tasks that we have to kind of check off. So it's it's definitely a crazy season. So I'm with you on pros and cons of type A.
So
what definitely pros and cons.
What traits as a type A person, because I'm sure you see type A, type B, but specifically talking about your high achievers that are kind of making that transition into motherhood, like how do you see those tendencies come out, both good and bad? Because it is a mental load. The type A thinks about a lot of stuff, as Hillary just said. You said earlier, the perfectionist, I can relate to that in such a like personal way that I want everything to go just as planned. How do you see that come out, in maybe your patients or your experience?
Yeah, what I see primarily with a lot of type A moms and when they become mothers or when they're pregnant, is this difficulty like asking for help, and not just asking for help, but then receiving the help if it's offered and available. So I see that a lot, where it's like, okay, we have to kind of practice at making needs known, right? And also then letting others step in to help meet those needs. And I think that's where I see one of the bigger kind of barriers to just that transition into like early motherhood is this inability or this kind of real difficulty asking for help. The other thing is sometimes where I see it, and if it's someone who is more career driven, I see the demands that come up between like parenting and then also career and ambitions. And then just kind of feeling like at odds with that, gosh, it's hard to like find and fit motherhood in also like my passions for my career and trying to kind of find this middle ground between the two. And so to me, I see a lot of that kind of coming to the surface. And then for a lot of type A moms, I also notice, and I think this is kind of, I don't want to just, generalize it or just tailor it to type A moms, but I think it's pretty general when it comes to mothering, kind of like this default parent, and that oftentimes mothers assume this role of primary caretaker. And that's where I see a lot of the kind of rigidity for type A people. or type A individuals. And that's where they really struggle. It's like now they're picking up just too much responsibility, or the rigidity in that, like, nobody's going to do it the way that I want it to be done. And so I'm just not going to ask for help because it's not going to be done, quote unquote, correctly. Right. So that's where I think we can see some of that like hindrance and that struggle with somebody who might be a type A personality.
Question about type A, just before we move on. Is type A nature trait or nurture trait? Is it written in our DNA if we're type A, or is it something that we're taught or we kind of become because of our surroundings?
So I would say, there's like temperament, right? And temperament is more innate to just like who we are. And you can kind of see things in Hillary. You might be able to speak to this in like the baby field, right? Where you have temperaments for babies, right? Some babies are a little more easygoing. Some babies are a little more high needs and they just demand more. So that is kind of like this innate way of being is temperament, and personality oftentimes is then shaped by the environment around us. And so I'd say a lot of personality is shaped by the way that you were raised, your life experiences, certain traumas, whatever that might be, right? That's kind of shaped and formed this personality. But I would say it's kind of a mix, right? Because you have the temperament piece also then combined with some of that those personality traits.
Yeah, that is interesting. I was going to ask you about type A moms and feeding their baby.
Okay.
I know this is something we could probably do a whole nother podcast episode on. So we'll just kind of breeze over it today, and maybe you can come back later and we can talk about this more.
Yes.
But I have my thoughts as a lactation consultant and nurse working with moms, but what do you see? Because they probably really, I see them and then I refer them to go see someone like you so that they can really get the support that they need. I can be a listening ear, and offer some, strategies I personally use, but really highly recommend working with someone like you. What do you feel like? Can we talk a little bit about that component? I don't know if you feel comfortable sharing anything personally with your kids, but I know for me with my last baby, Clay, he was the most challenging. He was my fourth baby and I was an expert in this space, and I still had so many challenges with feeding. And if I hadn't been the seasoned mom that I am and didn't have accesses to the resources that I had, and I didn't know to ask for help, and I didn't have a good supportive partner, I could have really, really spiraled with just thoughts that I had about, I'm a fake. Like I help every other mom that I work with. I help them meet their breastfeeding goals. I help them, and I can't even help myself. I can't get my baby, just this, I'm a failure. And I knew they were lies, right? Like I knew they were lies because I had people in my life that were speaking that to me, and I knew it, but I feel like there's so many moms out there that maybe are new moms and don't know. I mean, as a first time mom, if my fourth baby had been my first baby, I would have been in a really bad place.
Yeah. So, I'm glad that you kind of shared a part of that experience for yourself. For me personally, I struggled a lot with this with my first. And I think where I see some of the challenges come up is when there are challenges and struggles, then this tendency to kind of really personalize that and internalize it as like, I am the problem, where I would say, obviously, like I've done my own mental health therapy too, and I've gone through my own process in that as well. But through that, you do come to realize that there are certain things that are just truly beyond our control, and I would say for somebody who has a type A personality, that might be a little bit harder to sit with. It's hard to just like, we want control. We love control. Like, what do you mean I can't feed my baby in this way that I planned out? I read all the books. I did all the thing. I have all the knowledge. Yes. Right. And it's not working out that way. And for me personally, I struggled so much with breastfeeding that I really made things so much harder on myself that I needed than it needed to be, and there was also this determination, which, it ended up kind of working out after a period of time, but only for a little, like there was just always this ongoing struggle, but I'd say the inflexibility to say, okay, hey, I can switch, I can pivot, I can, find other ways to kind of feed my baby. I don't have to solely stick to breastfeeding, but I just had this part of me that could not let go of I had to breastfeed my child. Long story short, we did not at 8 months, it was finally okay, what are we doing here? And I did finally get to that place where I was like, okay, we're done. This is just not helping anybody. And we had the other options, and I did use formula, and it just was like a weight that was lifted off my shoulders, but I did carry so much guilt around that. It was so much, and I personally, as a provider, I'm like, yes, you need to do what's best for you, what's best for your baby, and the love is more important than how you're feeding your baby or what you're feeding your baby. Right. But in my own experience, I had such a hard time with that. It just was it felt impossible for me to do. I did it, and I'm glad that I did it, but it was hard. Yeah,
no,
go ahead.
I agree. Well, I was going to ask you, do you think that social media had anything to do with how you were feeling, or do you feel like it was mostly just internalized, kind of your own narrative that you were telling yourself, or did social media trigger anything?
Or otherwise, social media and otherwise. Yeah.
I would say I think it was a combination, because I went into it feeling like I was prepared, and that's what I wanted to do. I had kind of these goals, and I would breastfeed for at least a year. Right. And absolutely, there was kind of social media influence in that because, okay, you want to try to reach these goals a year, 2 years. Everyone has their own kind of personal timeline with that, but also hearing things, like breast is best and all kinds of, and it's just, this is one of those topics too, where it's so polarizing on social media.
Yeah.
That it does, I think, impact a lot of us as moms. We're not immune to that. And it is hard. It was hard to just see, people portraying this kind of magical experience of breastfeeding when that was not my experience with my first, and actually, in fact, I would say for all of my breastfeeding experiences, I personally wouldn't call all of them magical. So that's just been my experience.
No, me too. I'm with you. Yeah, I think social media is just hard because you can get a lot of good information on there. But like you said, formula and the way that we're feeding our babies, it is such a polarizing topic. It's just such a polarizing topic, and people get angry so fast when you're not 100% for their perspective. And so I think that's just a hard, and I don't think that's ever going to change. I think it's going to be, it's always going to be like that, which is a little bit unfortunate, but
yeah.
So Erica, what, I know you have a question that you want to get to, but I guess my question is, as far as what advice do you have for moms for kind of managing postpartum, preparing prenatally, but also in the postpartum period? Do you have any kind of things that you would recommend are must address or things that they can do to prepare to navigate this postpartum if they know they're a type A mom?
Yes, I would say first and foremost, please just give yourself so much grace and compassion. You have to soften that inner critic, right? You have to be aware that there is that inner critic, that you are your biggest critic, and you have to soften that voice, turn the volume down significantly on that. You have to give yourself grace and compassion as you're navigating something that's totally new. And I think a hard thing for type A moms, it's something is so new, and typically, a characteristic too is when you try something, you're relatively good at it, right? It's kind of okay,
yes, I
don't have to try super, super hard to be good at this one thing, And so you kind of go through life in that way where okay, I'm pretty good at the things that I set my mind to and the things that I do. And there is, that sense of control in that, but you become a mom and that kind of just all goes out the window because it's not just you anymore. It's this little tiny human that depends on you and needs you for every little thing. And so, you kind of are met with this reality that like, okay, wait, I feel like I might not be good at this. Right. And you kind of start to doubt yourself in those decisions, because there's a lot of decisions that need to be made and there's a lot of adjustments. But I'd say the biggest thing is don't believe that, right? Like, don't believe that lie. You are the best mother for your baby, always, always. And you have to speak to yourself kindly as you would a friend. And you have to give yourself permission to be kind to yourself and not to just, kind of beat yourself down. And I wouldn't say it comes out. It's not even like outward expressions mostly. It's just kind of like this elevator music that's on, in the background, but it's there. And, you're constantly like not feeling good enough, feeling worthless, feeling like you're failing your baby. You thought you'd be better at this and you thought you'd be a good mom and you desire nothing more than to be a good mom. But the fact is you are a good mom and you have to allow yourself to believe that. And there's a learning
It's
curve,
almost like
right?
you wouldn't be as upset about it if you didn't care and you weren't being a good mom, right?
Totally. Yes, exactly. And I think one of those things too is to be aware of some of the, I think sometimes what I see often is this tendency to, kind of anticipate, like in order to manage the anxiety, you kind of anticipate the anxiety. And so you try to plan for all the things and you're kind of like fortune telling, or you use maybe like one scenario or one instance where things didn't go great. And then that's like playing in the narrative for the remainder of like however long, until you decide to change it and do it differently, where it's like, gosh, okay, this happened last time and I know it's going to happen again. And so I'm just not going to try. I'm not going to do it, or, and there's this like fortune telling piece. Like, I know exactly how this is going to go. And it's like, okay, no, we have to leave room for things to potentially go differently. And not trying to plan and problem solve everything all the time, because that's not helping your anxiety. It's actually just making the anxiety worse when you think you can plan for everything. You just can't. You literally cannot,
Yeah, there's so much out of your control, which is so hard. So when I'm doing prenatal consults with moms in my office, I have private practice in Charleston, South Carolina, and we help with breastfeeding and baby sleep, but just also just general postpartum that first year. And it's usually type A moms come in and do the prenatal consult, which I love. I can relate. And, we talk about breastfeeding and we'll talk about sleep and, they have their list of things and we kind of talk through all this. But at the end of it, I always talk to them about sleep and coming up with a postpartum plan and having like open communication with their partner. I think if moms, I know from me personally, what I experienced, and I wouldn't say that I really got this right until our fourth child. And even going back, I'm sure I would do things differently, but if you can have, and I know that this is a luxury for a lot of people. I know that there are many moms who might not have this ability, and I understand that. But if at all possible, I feel like having no responsibility in those first 4 to 6 weeks postpartum, like other than just feeding yourself and feeding your baby and just kind of not having to make any decisions about what's for dinner. And this can kind of lead us into talking about the default parent a little bit if we want to go there, but just not having to make decisions and just really focus on yourself. And so I have this handout that I give out, and it says, it's a list of things that you write all your tasks down, and it's a list of things that you're going to do, that you're going to delegate, that you're going to defer to someone else, or that you're going to delete. And I got that from the Boss Babe. I don't know if you know who the Boss Babe is, but Natalie Ellis, she is great, but she's not in the motherhood space, but anyway, I thought she helps business coach for type A women. Okay, so there you go. Okay. But I just think that's such a great concept to like write down, like, yes, what are the things that you're actually going to do? What can you delegate and get off your list? What is like not a priority? Like just defer until later or just delete, because we all know that we're probably doing a lot of things that we don't really need to be doing. And then also I found that talking to moms about their partner and having, I give them a little sheet with like prompting some questions. Okay. You guys should talk about this before. Like one of the things that my husband has always been for us is the line of communication with family, or if he sees me shutting down, he's like ready to spring in and be assertive, or just helping hold boundaries during that space because moms are really vulnerable. We're really vulnerable in that period for so many reasons. I think one of them is just because our heart is growing so fast with this new baby. And there's a lot, we're sleep deprived, right? Like not getting through a REM cycle is not great for mental health or even your physical. Yes. So
and all the things.
Yes.
Yeah.
I know. So I love
when you're a mom.
That connection, feeding and sleep. And I love helping parents and moms really understand the connection between feeding and sleep with their babies. And I'm a IBCLC, I'm a lactation consultant. And there's a lot of lactation consultants that don't agree with the message that I put out there as far as really helping prioritize mom's mental health. And I'm not saying that you can exclusively breastfeed and still prioritize sleep. And so I think that it just takes some strategy. It takes knowledge and strategy and planning. But when you are a type A mom, you're usually good with all of that. Yeah. Yeah. Like if I have a plan, if I know the strategy, if I know how lactation works, if I have the information, I'm going to make it work. Right. Because yes, I want what's best for my baby. And I'm not saying what's best for your baby is a mom that is doing well. Right. And so I think sleep, I like to try and get, when you deliver your baby, there's all the endorphins and you get that surge of hormones. Yeah. And so I feel like we kind of live on a high for, a couple days, and then like 7 to 10 days, you're like crashing, right? It's a crash. Yes. You're tired, it just hits you. And usually by that time, mom's milk has come in if she's breastfeeding. And so I think it is so important to have a feeding plan where we know your baby may not be sleeping 4 to 5 hours at night by that point. They're not going to be going more than 4 hours in the first 2 weeks, but there is a way to do a pumping session or hand express, and we can pace bottle feed your baby in this short amount of time in these couple weeks until they're big enough to take in a full volume to then be able to go a little bit longer. And we can do that without sleep training or without crying it out. We're literally just optimizing
and I think
for
without
feeds.
Compromising, milk supply, right? If that's a concern too. Yeah. Yeah.
Yes. There is a way to do it, but I get so worked up when I see things on social media trying to tell moms that they can't sleep if they're going to breastfeed. I feel like it's a lot of moms off from breastfeeding for them to think that, well, the only way, because that was me, like first time mom me, I thought that what I was told was that if I didn't basically provide unrestricted access to my breast with my baby, that I wasn't going to be successful with breastfeeding. And it's just not, sleep is so important. And I would argue that it's also important for our babies.
Totally.
Yeah. And I think it's important for babies. I think, I'm not saying that we're having a, 2-week-old sleep 12 hours at night, but that to me is what I'm seeing is a huge piece of the puzzle when it comes to like moms and feedings and sleep and all that.
Yeah, I would say, sleep, and in all honesty, I can even personally identify the days where I'm like, oh my gosh, like I am so irritable. I am extra moody, and it's directly correlated with sleep.
Yes.
It's like,
100%.
Okay, I was literally awake from like 1 a.m. to 3 a.m. And then in between that time to, all the wake ups around that and just all the things. And I do not show up as the same person the next day when I've had a really rough night. versus when I maybe have, a consolidated like 3 hours of sleep with maybe like a 10 or 15 minute kind of wake time feeding baby. And then another maybe 3 hours, or 4 hours. If I can get like 4 hours in, it's like, okay, this is good. I can function.
It's the magic number, right?
Yes. Like if I can get a stretch of 4 hours, we're golden, and I'm not saying 4 hours in the whole night, but just like one solid stretch of sleep throughout that night.
Totally.
But it does affect mood. And there is a lot of correlation between sleep and sleep deprivation and mental health and mental health concerns and issues like postpartum depression and anxiety. There's just direct correlation between that.
I feel like I talk about this book in every podcast that we record, but have you read that book, Why We Sleep by Dr. Matthew Walker, I think is his name. It's called Why We Sleep.
I haven't.
But it's an evidence-based book on why we sleep. It's a great book.
Yeah.
I highly recommend reading it. It's really it's very insightful. I thought I knew a lot about sleep until I read that book. And
I'm going to have to read it as much as you reference it so I can start being a part of that conversation.
He hits on, he does talk about pregnancy and infants and sleep like a little bit. It doesn't go into it, but there is a little bit of information in there that is really fascinating. So highly recommend for moms to read for sure.
Yeah. So Alice, do you recommend introducing, kind of a therapist as a kind of preventative way, and meaning like in a prenatal space, should you start seeing a therapist if you're a type A person, or do you think it's more of if you feel like you're kind of losing it, you should start seeing a therapist? Like when do you recommend getting involved with a mental health?
My approach is always like, and it could align a lot with a lot of type A moms too, but it is important to be proactive about it, right? And to not kind of wait when you're in crisis. It's so much harder to get set up with somebody, to find somebody when you're in crisis mode. And I do think when it comes to this kind of postpartum planning, a therapist or like a mental health professional should absolutely be a part of your support system if you're able to make that happen. If, I know there's like access to mental health, there's like a whole nother conversation about that. But if you are able and you're in a position to make that happen, and you can, proactively set up appointments with a therapist and kind of solidify somebody. And even if you're not like meeting with them every week, because you're like, okay, I don't really have a whole lot right now, maybe, right? But just proactively saying, okay, like, let's check in, let's see how we're doing. So that when you do need some extra support, you already have that line of communication open and you already have that kind of established.
You know each other.
Yes. Yeah. And so I definitely recommend a mental health provider or therapist as a part of that kind of support system, as much as you would have some, like an IBCLC or your OBGYN or midwife, right? Whatever that might be, or a postpartum doula. Like let's add, mental health therapists to that too. And obviously I know, again, like access, it just varies in that regard too. But if it's possible, then I would definitely recommend and encourage it. I personally haven't met anybody thus far who's like, man, I regret like having a therapist. So
yeah, I've never met that person. Yeah.
Yeah, I haven't either. So, and it is someone to just have in your corner too, and someone who can also just keep you in check as well. There's that emotional support that can be there, but also just the accountability piece as well. And, being there to help you in a difficult and vulnerable time in life.
That was really my next question, is like, what is the therapist's role or the mental health provider's role? What should be the role that they play in, kind of a postpartum and preparation way of getting ready to have a baby. And what you just said is have that support person in your corner and accountability. And, that's great. Anything else that you feel like is a important part that they play in your insight?
Yeah. Encouraging kind of like that self-advocacy piece too, and I think that's more doable when you do have someone kind of rooting for you in your corner a bit. You're like, okay, yes, like I can speak out about this. I think a lot of moms do struggle with advocating for themselves. And sometimes it's because we don't know exactly what we need or what we want. But when you have that time to kind of process what that might be, then you have better clarity. You gain more clarity around that.
No, I was going to say, it just made me think about the conversation I have with a lot of moms that, in the early postpartum days where they're trying to decide what they want to do related to feeding their babies. And I always say, like, let's not make a decision today, because it's hard to, when you're emotionally charged or you're sleep deprived, again, you haven't had any sleep.
And sometimes both.
Right. Then, okay, let's come up with a plan to preserve what we have right now, and let's get you a good solid 4-hour block of sleep for a couple nights. Let's get some naps, and then let's see how you feel, and then make a plan from there. Because I personally, my husband is not a mental health therapist, but he did every time I had babies. And I was like, you know what? I'm done. Like, this is, I had a bad day. He would be like, well, don't do anything today. Let's see how you feel tomorrow when you wake up. And, and then, so I think that that's just such great advice. It's just, and if you have a therapist that you can really talk through it and have an expert advising you, I think that would be a major bonus.
Oh, no, I was just going to, kind of shift gears and ask Hillary, you just shared feeding is something that is an anxiety inducing situation, maybe for a new mom. What are some other maybe common anxieties or common worries that maybe both of you see in new moms? And then maybe Alice, you can talk about some insights and maybe some ways that our early moms can manage those anxieties.
I'll start with a couple things, and then I'll pass it off to you, Alice. I think a lot of moms are worried about their baby dying of SIDS. Like, is my baby breathing? Are they, the feeding thing is it's a huge thing. I would say feeding is the most, just breastfeeding and any form of it, whether they're combo feeding or whether they're exclusively directly feeding at the breast or whether they're pumping or triple feeding is by far the biggest worry and concern. But then it's also lots of questions and concerns about safe sleep and swaddling, and they really want to get sleep, but they're worried, or they're holding their baby, they're scared to go to sleep, they can't fall asleep when their baby's there because they're worried they're going to stop breathing. And then I feel like this has gotten better since we've kind of moved out of the last couple years away from COVID. But another big worry was just about baby getting sick. Is my baby going to get sick? I mean, even now I still have moms ask me all the time, about family coming to visit and, are they going to get sick? What's going to happen? So yeah, and I think for me personally, and I don't know if we have time to talk about this, but those intrusive thoughts that are just
that's like
that
where
show up is that
I figured that's where your mind was going.
Thoughts.
Yeah.
Yes. Well, I can give an example, and this is so crazy. I remember with my first baby, it scared me that I was having these thoughts, but it has happened to me every single time I have had a baby. This has happened to me where I'm giving them a bath. And I don't know, tell me if this is normal, but it's just like I have this feeling with, if I wasn't here, he would drown. Like, just that thought of, if I wasn't here, he would drown. And it's almost like I see it happening and I'm getting so anxious about it. And then I feel bad about the fact that I'm thinking about it. I'm not thinking about drowning him. I'm thinking about if I just walked away, or even like, what if I passed out, or like, if I wasn't here and he was in this situation, he would drown. And it has happened to me every single time I've had an infant.
Yeah. Those intrusive thoughts it's like 90%. So it's like 90% of like mothers will experience intrusive thoughts. So you're not really immune to them, They start to become problematic when we give them too much attention and focus just too much time and energy on them and see them as like a problem. Or then there's sometimes the fear of like, oh my goodness, like I'm going to act on this, and you start seeing like avoidance, right? You start seeing, okay, well, I'm not going to give my baby a bath because they're not, I don't want them to drown. And you start to see where that can like become a problem, right? Or you
Yeah.
see oftentimes like one of my intrusive thoughts, and it's been with just about every baby, but definitely with my first was like walking and just like the stroller randomly, I don't know why or how, but the stroller is just like in the street and there's like a car that comes by and it like runs over my baby with the stroller. And I'm just like, oh my gosh. And right, if you're giving a lot of time and energy to that intrusive thought, it can affect a mom to the point where she's like, well, I'm not going to go on a walk. Like that might actually happen. And now she's isolated and she's inside and she's not getting out and she's not seeking support and engaging with other mothers. Right. And that's where you start to see isolation creeping in, loneliness, like so many other things. So definitely intrusive thoughts can be problematic. It's not the thought itself that's problematic. I want to make that clear. The thought is just a thought, but it's
so
how we
what's your
respond
advice
to the thoughts.
For a mom that's having those intrusive thoughts. And I have not had an infant, but I feel like there's been times in my life where I've been high anxiety and had, you know, things like that cross my mind. And I'm like, that is not even reality. That's not, you know, the situation that I'm in. What do you tell new moms that are having those intrusive thoughts? How do you respond in that moment so that it kind of passes and you can overcome it?
When it comes to the context of like motherhood and that vulnerability, there is oftentimes intrusive thoughts are just it's like nature's way of just trying to tell you like, hey, you got to protect your little baby, right? But sometimes our brains just have a way of like taking it to the next level. And you're like, okay, like as a mom, you now have this ability to kind of see threats, right? Like you're like, okay, this could be a threat, or, you know, you anticipate like, okay, like I see a puddle of water and if my kid's walking on that, they're probably going to slip. So you like go clean the puddle of water up and everything's okay. Right. But so there's like a proactive look at intrusive thoughts as well, or not proactive, a positive way to look at intrusive thoughts as well is that they're there to just kind of help you assess threats, you know. But if you're finding that they are becoming impossible, they are difficult, you do want to go do the hard thing. You don't want to avoid what it is that your intrusive thoughts are kind of telling you, you know, and you assess the problem. Obviously, you take inventory. You know, I'm thinking of the example of like, okay, me imagining, you know, somebody running over the stroller, you know, with my baby in it, and then I would not want to go on a walk. The hard thing would then be, okay, I'm going to go on this walk. Right. Like you follow through and you then reinforce to your body and to everything around you that, okay, this was okay. Like we did it. Nothing horrible happened, you know? And then you have people who are like, well, what if it like the one time, what? And it's like, okay, we can't get into the what ifs, you know, we go down then the worst case scenarios. And oftentimes we know the worst case scenarios is the least likely scenario. They don't happen 99% of the time, you know, you just have to kind of reel it back into what is more realistic, you know. But I'd say when it comes to intrusive thoughts is doing that uncomfortable thing, you know, doing the opposite of what your intrusive thoughts kind of want you to do.
Finish the bath. Give your baby a bath.
Exactly.
Yes. So I did the right thing. We did a bath every night, but
yeah,
I mean, it really
bath,
scared
you know?
me with
Finish the bath, go on the walk.
Yes.
Go down the stairs,
choking is
hold
like
your baby,
oh
right?
man,
Like
going down the stairs holding your baby. But
Yes.
now my it wasn't really intrusive thought. I don't know, maybe it is, but I didn't like other people carrying my babies down the stairs. I was like, they're gonna fall.
Yeah.
I think mostly because I knew that I would not be able to forgive them. I didn't want to put myself in a situation where I was gonna have to forgive them for something that. So my biggest thing, this is a side note, and it's kind of related to motherhood, but not really. So I have a major phobia of alligators. We have a lot of alligators in South Carolina. And my husband is always like, babe, this is a problem. Like, and I'm always like, I know, I need to go talk to my therapist about this. Like, I don't know how to handle this, but is that more of a phobia? Can we even speak to that for a second? Like, as far as alligators go, for me, I'm terrified that my children are going to be snatched by alligators. It combines the two things that I fear the most, which are drowning in alligators because of the way that alligators would attack. So much so that I do not let my kids get close to situations where I think there could be an alligator in there. When we go out on the boat, I am very like on edge, high anxiety. Now, there is a real 12-foot alligator that sits there and stalks our boat when we're getting on the boat. So it's not like a imagined threat. It is an actual threat.
How many times have you seen this 12-foot alligator is my question.
I have seen him many times this summer. Many times this summer.
I thought she was going to say one time.
It's a very real threat, right? Like you've seen this thing, it's there.
Yes.
And you can, like, how are you mitigating that situation? Right. Where it's like, okay, we go on the boat, but okay, we're not like, nobody's hanging over the edge. Nobody, right. Like there's parameters, there's kind of rules in place for that. It's not, I would say in this situation, your fear is relatively valid. No, haven't seen that alligator. That would be would be a hard thing for any mom.
Okay. And I think that what I'm hearing you say, though, because there are times when I'm just like, all right, let's just avoid it. Like, oh, no, we're not going down there. I do feel like I do that sometimes as well. But that's hard because I'm sure, that was a little bit of a dramatic thing. But there are times in motherhood where, for example, starting solids, like that can be a real threat. That causes a lot of moms anxiety. And I personally have had an experience with one of my kids choking, and I had to do the back blows and chest. Almost had to do the chest thrusts. But we can't avoid starting solids, right? Like, right. Your kid has to eat solids at some point. So I think that there's a similar alligator situation sometimes with solids. And I feel like if I had to go back, I think that would be a good time to even work with a therapist to just talk through that while you're going through that, because it can be a real threat, but it's hard. I think a lot of moms kind of go through that alone, and it does cause more stress than I think is talked about.
Yeah. Yeah. I think with solids too, right? There's like purees, baby led weaning and all the things. And with that too, I just more so always encourage, like, do what works for you, right? Like if purees are what you're comfortable with for a period of time, like you are not messing up your child because you are offering purees, as you're working towards getting comfortable and your baby's getting more familiar with the concept of feeding and chewing and all the things, right? And using their tongue in a different way than they do outside of bottle feeding or breastfeeding. Like it does go back to just like truly do what works best for you and for your child, I
love that message. Yeah.
Well, let's shift gears and talk about, we've talked about all this is all mental load, right? For a new mom is all of these things that we're thinking about. We touched on it a little bit earlier, which is kind of that default parent role. And I think Hillary, you said it a little bit earlier where we take so much on in the mental load. And maybe Alice, I can't remember who said it earlier, but me being married for 2 years, over the last 2 years, I have learned that men and women are very different. And in a way that I didn't really understand, in that I have a much heavier mental load on the day-to-day and the daily tasks. And I know that that's going to get even heavier as we, have a baby and have more things going on. And my question for both of you as parents and experts in your field, do you feel like the mental load that women take on, and again, that's not a dig at men, that's just, I think, how men and women operate. Do you think that women typically take on the default parent role because we are so task oriented, and especially in the type A mom, we want to make sure everything goes the way that we want to go and how we've planned it? Do you see the default parent defaulting to the mom because of that? And let's just talk about, both of your perspective on that default parent.
Yeah, I think gender roles, kind of come at play with when we're talking about the concept of a default parent. And I think obviously like women and mothers and just growing up in history, you've been taught that, okay, it's more like childcare, right? Like if we're talking again, like gender roles, women are more likely to do caretaking tasks, to, do household chores, that kind of stuff, right? And then men are kind of outside the home, working, earning. So there's just a lot there when it comes to the gender roles that influence sometimes that default parent um, responsibility. But I think with a default parent, there's just so much like mentally that's invisible. And I think sometimes expressing what that is and just getting it out and making it known, sometimes it's not even so much about like, hey, I need it to change, but it's more so, hey, I just need this to be seen. And like, I just need this to be acknowledged and addressed and just like, see me in this, and then there are certain instances where, yes, changes could be made and, you're wanting to kind of shift from carrying that mental load because it's too much, it's too heavy. Discussing that with, there you are, discussing that with your partner, right? If that's the situation there. But I think there's just so much with like the mental load all around.
Okay. So what I have to add to that is just as a new mom, and, whether you're a new mom for the first time or if it's your fourth baby, making sure that you support your partner to be able to help you, right? Like trying not to micromanage every move and giving them the space to be their own parent, because I do feel like, and I've heard this from my husband, and then I've also seen this in real life, is that sometimes because it's easier if we do it, or we don't have to ask for help. Like we were talking about earlier, it's just easier if we do it. But then that sets us up to take on more of that mental load down the road.
It might be
right?
effective like in that short term, right? Like in that moment. Yes, it probably is easier for you to pack the diaper bag. Sure. But it becomes a problem long term when that's then constantly now like your role, and suddenly your husband's like, or your partner's like, I don't know how to pack the diaper bag. Like, you're so good at it. Why don't you just do it? And you're like, I'm freaking sick of packing this diaper bag.
That's where I get to, like, they're a new parent too, right? Like the partner is a new parent too. So it makes sense that if you are just taking it all on, they're never going to learn and become their own parent. And then you, as the default parent, don't have a choice because they've never done it before. And so then it is easier just to do it yourself. And you don't want to get in that kind of vicious cycle of being the only one that knows how to take care of the baby.
Yeah. I would say as a type A mom, right? Like where you see that come in, it's like, if it's not done a certain way, then it's not done correctly. And that's where I would encourage just openness to, there are a lot of different ways of doing things, and there isn't just like one right way. Sometimes, sure, could there be ways of doing something a little better? Yes. But at the end of the day, is it like a make or break? And you do have to ask yourself that, like, is this going to make or break this situation or this experience? Is it a safety issue, right? Because if it is a safety issue, then yes, address it. You don't want to put your baby in danger or anybody, right? But if it's something that really isn't, a safety concern, it's not that big of a deal, like, truly, orient yourself to asking like, okay, is this worth me addressing? Can I let it go? Doing that internal work to say, okay, I'm gonna be okay with letting it go. I'm gonna work on that. And just also giving yourself that opportunity to acknowledge that there are a lot of different ways to do something, and your way is not the only way.
I have to do that at work a lot.
Yeah.
And my role has gotten bigger over the years. And so I used to do this exact job. And now as the years have gone on and my role has grown and I've elevated, I've had to remind myself in certain circumstances, okay, I can't do that job and this job. So maybe it's not done exactly how I would do it, but it's done well, and
yes,
and we're fine, and we just need to move on with it because I can't do everybody's job. And that's, I think, crosses over in this territory where you do have a partner, if you have a partner, you're going to end up taking on that whole job if you want perfection and you think that you're the only one that can do it the right way when they can do it
And
in a totally adequate.
resentment starts to build, right? In that situation too. I know you were going to add something, Hillary. Yeah.
Well, I was going to say, just verbalizing what you need, because I have found that working with new parents, a lot of partners are ready, willing, and able to help in whatever capacity. They just need to be told what you need help with. And just even, I mean, it's not assigning jobs. It's not like that. I wouldn't necessarily think of it like that. But for example, my husband and I, we've been married for 15 years and we have 4 kids, and we have things that we do. You know, I work outside the home. He works outside the home. Just for example, school is back in session. So we both get up at the same time in the morning. I get in the shower. He goes in the kitchen. You know, he wakes the kids up. He goes to the kitchen and gets his coffee, because that's literally, actually he gets his coffee before he wakes the kids up. He gets his coffee before he goes to the bathroom. Like, he just has to have his coffee.
The first thing.
He just does it first thing. But anyway, he gets the kids up, he gets breakfast going. He kind of orchestrates that. I get out of the shower, get dressed, and then we swap. He goes in the bathroom, I go in the kitchen, and I will deal with I get our toddler up and change his diaper. And I think we've kind of evolved into that because we've had conversations about it. But like you were saying, resentment, if you're not having conversations about it and you're just taking on more, or you feel like you're taking on more, it's not resentment. Definitely. And resentment is what ruins relationships, right? There's that saying, resentment ruins relationships. And at the end of the day, one day all of our kids are going to grow up and leave us. It's just going to be you and your partner, And so I think that's just, it's hard. Early parenting is just it's a huge, I would say it's probably, becoming a new parent is probably up there with what are the big life stressors, like moving house, starting a new job. I don't know. I'm sure you know the list, but becoming a new parent is a stressor, and you guys are on the same team. So I think your partner's probably not going to read your mind. So you really need to verbalize. And sleep helps you to be a better communicator.
Yes, so it does.
You can get some sleep.
It does.
Yes.
I would also like to add that on the other side of that coin is, yes, those conversations need to take place. But the other person also needs to then step in. It's like,
totally.
It's like both individuals. It's not just, you saying what you need. Yes, this other person does need to then step up to the plate, so to speak,
Absolutely. Yeah, absolutely.
Yeah. So what are some tips for type A moms navigating postpartum? I know Hillary and I talked a little bit about, what you can do to navigate it and make sure that you're prioritizing your mental health. We've talked about a couple of things, but, just to hear from you to kind of round out the conversation.
I would say my biggest thing, and what comes to mind, like, just immediately is, like, you can do all the things. You just can't do it all at the same time, and I would just, like, that is kind of what I would leave all my type A moms with. Like, yes, you can do all of the things. You have to pace yourself, and you can't do everything right then and there when you want to do it, So I think that is just such a useful thing to, like, carry with you.
I agree.
Like,
That's
I could do all the things, but I just can't, I don't need to do it all right now either. There's kind of like a time and a place for everything.
I love that. Different paces for different seasons of life, right? Like, you have your priorities, and I love that.
All right. Well, Hillary, is there any other questions that you have for Dr. Alice before we let her go this afternoon?
No, I think that was a great conversation. I'm excited. Where can people go to find out more about you and access your resources?
Yes. So my website, that's like the easiest way to get a hold of me in any capacity. So it's just www.dralicePsyd.com. But I'll spell that out. It's DrAlicePsyd.com. So yes. And that's where my social media is too, at Dr. Alice PSYD. And then doctor with a DR, the abbreviation, not spelling out doctor.
Awesome.
Great.
Well, thank you so much for joining us.
Thanks for having me. I enjoyed our conversations, and, please let me know if you want me to come back. I'm happy to do so.
We'd love that.
Thanks for listening to the Early Momming Podcast. Before you go, can I ask you a favor? If you enjoyed listening to this podcast and you're excited about what we'll be talking about in the future, please text your best friend this episode and tell her to give us a listen. And if you have time, do you mind going to leave us a review? Let us know what you liked. We are here to serve you. Plus, your reviews will make our podcast more findable for other moms to be able to join in on these candid conversations. Shout out to our sound guy, Kyle Moore, who makes it way easier to listen to us. And if you need to get in touch with us, send us an email at podcast@babysettler.com or send us a DM at Early Momming Podcast on Instagram. All right, we'll see you next time.